Hello and welcome to The Print. I am Sumi Sukanya Datta with The Print, and we have with us today Dr. R.M. Anjana from Madras Diabetes Research Foundation, and Dr. K.P. Singh from Fortis Hospital, Mohali. Both of these doctors are very known in the renowned in the field of diabetes, and Dr. Anjana Mohan, in fact, was a lead investigator in India-B study, which came out last year and showed that there are 101 million diabetic patients in India. Dr. Singh has been associated with PGI MER Chandigarh formerly and is a known name in the field of diabetes. So thank you so much for joining the conversation, doctors. And so today we are going to discuss primarily about diabetes reversal. Now, diabetes reversal is not something entirely new. We have been hearing about it over the last several years, but there are various tech companies, health tech companies, which offer these services, and we see a lot of them, bombarding our social media timelines. So there is a lot of interest around that. So our conversation will largely about this topic today. So can we start, Dr. Singh? What do you think
Yeah,
this
please. Yes.
diabetes reversal is? How does it work, and for who does it work?
Diabetes reversal is not a common. It is very uncommon. I will say it is rare, but it is possible. Possible, but with difficulty because of the behavioral problem, because of the busy
Yes.
life. But it is possible, and it is not. You can say if the many will not agree to change the lifestyle because you have very low caloric diet and you have to do the great change in the lifestyle. So only the few agree, and out of them, few will show the remission. But the total reversal may not be possible because once they come back to their original lifestyle, they regain the weight and their diabetes also getting worsened.
Right. Dr. Mohan, you want to chip in here and speak about
Yeah,
it?
sure. So, thank you, Sumi, for having us on this program. So, I think first of all, the right term that we use is not really reversal. That's easy to understand, reversing diabetes, and so reversal. But the scientific terminology that we use is called diabetes remission. Now, how does one define this? This is defined as having a HbA1c. So, HbA1c is the test that is actually gives a 3-month average glucose value for a patient. It also can be used for diagnosis these days. So if you have an A1C or a HbA1c value of less than 6.5 within a 3-month period without diabetes medication, so then you can define this person as having remission or reversal of diabetes. So that is what we're talking about here. Now, is diabetes reversal remission possible for everybody? Now, it depends, of course, on what type of diabetes you have. There are many types of diabetes. So type 1 diabetes, when there's absolute insulin deficiency happens in children, remission is not possible. Many other types of diabetes are there. Again, remission becomes difficult. Now, in type 2 diabetes, which is the large part of diabetes that we have, 95% of all diabetes, also we have subtypes where you get
Right.
diabetes because of insulin deficiency. Such people, it's very difficult to reverse. But there is a large group of people for whom the diabetes comes because of obesity or increased body fat, and that leading to diabetes. Now, this is a subset of individuals in whom we can try the remission programs and the remission things. So the other types, there are further subtypes. All of these are plus minus. So it depends entirely on what the subtype of diabetes, the person has. And there are ways to find out which these subtypes are. So using an app that doesn't really, give you much science behind this, one must be careful because we don't really know, who you're dealing with. If you do this in a clinic with a doctor with the right science, there is a subgroup of people for whom diabetes reversal is possible. The large group of people, like Dr. Singh correctly mentioned, it is really difficult to do so. in a small category. Scientifically, what we find out, it may be safe to do so. But trying on everybody in a large population without the proper science may be, a safety issue that one must be aware about.
Yeah. So now there are these apps, as you mentioned rightly, which some of these claim that it can be reversed in up to 90% of the people who are diabetic. Also, that using their programs allows you to have the food of your choice, sweets that many diabetics actually crave for. You can have if you actually you go for their programs. Are those claims actually accurate? What do you think about it, Dr. Singh? We'll first start with you.
Yeah, I think one what Dr. Anjana said is right. That is only the few subtypes of diabetes is possible. Like in the few type one diabetes, we don't expect remissions and and the reversal. Only sometimes you have the honeymoon phase of diabetes, but that will not we will not say that is a reversal. But some in genetic syndrome like more maturity onset diabetes, it is not possible because the genetic. But once you have the obesity and you have a diabetes and you had rapid gain of weight and you can reduce that weight, then that is possible for remissions. And Dr. Anjana said, reversal is only very rare. But and as you see that few of the patient, once you start anti-diabetic medications and they have the change of lifestyle medications, they reduce their they keep on reducing their HbA1c and they come to less than 6.4. At that time you have to stop the medicines and you will say they are in the remissions. And but if they continue with this lifestyle, they will keep on having in the remissions. And you see the various app and various naturopath ones. Yeah, I agree that claim the naturopathy centers, like few naturopathy centers, they changes the lifestyle. And after that I have seen that patient reduce the weight, patient is having the low caloric diets, and they are helpful for some times. But many of them get back to their abnormal behavior, whatever they have the previous behaviors. So it is possible, but it is not a persistent. The consistency is not there in their claims.
Right.
Yeah.
We would also like to hear from you,
and
Dr.
and
Anjana.
and I totally one thing I would like to comment here, that Ramdev keep on claiming that we cure the diabetes, I cure the diabetes. Type 1 diabetes cannot be cured. That is absolutely a misinformation to the public, not only to the India, by to the world. I will say world, that he is absolutely wrong. That type 1 diabetes he cannot cure it. Type 2 diabetes, yes, he can help to change, but it's absolutely wrong to say that patients को diabetes ठीक कर दिया, patient का cancer ठीक कर दिया. That is absolutely wrong on the part of Ramdev. I'm
Yeah.
not personally criticizing, but one should speak in public whatever is on the basis of the scientific data.
Yeah, Dr.
Yeah.
Anjana, you want to add something to it?
Yeah, so I agree with Dr. Singh. I don't think type 1 diabetes is currently, with the science that we have today, not curable. So, yeah, I would have to agree with that. Now, regarding 90% of all diabetes being cured, I don't think that is true. There is no science behind that at all. A small percentage, maybe, yes, you could think about it, but that's definitely not going to be 90% of all diabetes. Regarding eating whatever you like, all the sweets and all that. Well, that's what everyone wants to hear, no? So that's what will sell. So people generally have to, people have to, well, it has
Cater to the sentiments. Yeah.
yeah. So, I mean, that's what, see, the thing is, if once you reverse diabetes and then you get there, then there are a few things that you can allow and it becomes easy for that one or two people. First of all, the percentage achieving that, like Dr. Singh very correctly says, it takes a very drastic change in lifestyle, Oftentimes, more than 10% of your body weight you have to lose. All these are not easy things to do. But once you do it, for those who have achieved it, yes, for a period, it's very essential to see you don't regain that weight. And like he said that really well. You go back to your old behavior, no, what caused it in the first place? You get back there ultimately. And then for a period of time, you do this for 15 days, 1 month, 2 months, 3 months. Yes, you will see the effects, no doubt. But then you get back, isn't it? You have to, for the rest of your life, you have to continue that. So keeping it there is not easy once you've done something. But if you do that, yes, you can allow on and off. But it is not true that you can have sweets, whatever you like. If you just get onto a tech program, life would be so easy, no? If it were that, you could just, all you have to do is open an app, then eat whatever you want, do whatever you want, and you can wish diabetes away. I wish it was so simple, but unfortunately, it's not.
Dr. Anjana, can you also please share, whatever, there was some work related to diabetes reversal or remission also from your India B study. Would you also like to talk about that?
Sure. The ICMR INDIAB study is a national study on diabetes and all of its complications. So what we have done in the study, we've looked at various things, including diet, physical activity, obesity, etc., etc. Now, what we try to look is in INDIAB. So INDIAB has entire India, every state studied. We have urban, rural, male, female, everything. It's representative of India. That's why it's called INDIAB, India Diabetes Study. So what we've done here is we've looked at what dietary composition can help someone with new onset diabetes to reverse their diabetes. So there was a question on, very fat diets, doing hard things. So we find for the subpopulation in whom reversal is possible and safe, in such people, the following dietary composition may help them to bring their A1C less than 6.5. So for this, carbohydrate stays at around 50% of everything that you eat. So currently it's between 60 to 70%, sometimes more. Everything we eat is carbohydrate, right? Whether it's idli, dosa, your rotis or pasta, noodle, whatever you eat is carbohydrate. So if you decrease that carbohydrate from that 50, 60, 70% to 50%, it's not a very drastic change, but make that 50%. Then the other 50%, what you can do is 25% ish is fat. Already India eats about that much. That's good, stay as it is. But what you kind of increase, when you decrease something, you have to substitute, isn't it? It's important to see you do not substitute the carbohydrate with fat. Rather, you have to substitute it with protein. Today, India has about 10, 11% protein that needs to go to about 20%. So 50% carb, 25% fat, 20% protein, the other 5% is fiber. So fiber is about 2% currently. So these changes to the diet at a population level has the ability to cause remission of diabetes.
Okay. Also, some of these, claims that we keep hearing are that these diabetics can actually go off medications completely. Can you also talk a little about that?
Yeah, so that is what remission is, going off medication for at least a 3-month period and keeping your sugar normal. So once you follow these kinds of diet, you have to supplement this with physical activity, because one must remember that when you lose weight, not only do you lose fat, but you also lose a lot of muscle mass. So in order to prevent that, it's extremely important to see that you supplement with exercise, especially some strength training along with the aerobic activity that we all know about: walking, running, cycling, etc. But a lot of people don't know or understand that they also have to do some kind of strength training. So this will protect your body from losing the protein and muscle mass also. So remember, in the diet, we've increased the protein intake, decreased the carb,
Right.
exercise in which you're supplementing, strength training. This is the kind of formula. And of course, some stress related therapies and yoga, things like that. This is the formula which will help someone to actually lose weight and remit diabetes.
Dr. Singh, you also want to add something, please?
Yeah, just to have some time, patient wants but is not able to get because of the obesity. So in that obesity, just to help that patient is committed, but patient because of the heavy weight, patient is not able to. Few drugs can help, and now we have seen in the clinical trials because now after that we know that the patient is on active substance or placebo, on the placebo. The GLP-1 based therapy, GLP-1 analog therapy, that is available in injections weekly, or or daily, or sometime in the oral tablets. They have seen that they help to diabetes remissions. Once you have to keep it off the anti-diabetic medications, because they help basically to reduce the obesity. And once you reduce the obesity, either because of drugs or because of the bariatric surgery or because of some ballooning by the endoscopic, these people help and they go into the remission for the diabetes. And these therapy, yes, definitely help in a committed patient, and we have seen in practical life, and they do help. So combination
So,
of
Dr. Singh, yeah, please. Yeah, yeah. So, you mentioned
combination of
about
the
this
lifestyle,
GLP-1.
diet, and the drugs, the modern drugs, which can help.
Right. So, you mentioned about these GLP-RA medicines already,
Yeah,
like
yeah, yeah, yeah,
semaglutide and
yeah,
tirzepatide, the brand names of Ozempic
yeah,
and
yeah,
Wegovy and Manjaro that we keep hearing, especially in
yeah.
US and other countries. And now semaglutide is also available in India, of course. So let's go on to some of these obesity, diabetes medications now. Diabetes and obesity are interlinked. People who have obesity are also have diabetes in most cases. So who does these medicines actually work for? Is everybody ideal candidate for these medicines? Are there any side effects? Who is the target
Yeah,
patient?
one is the main problem is the cost. Cost of this medicine is
Right.
expensive,
That's the
because
main
in the
side effect.
in the clinical trials they usually get the free of cost, but once the trial is completed, they are off the medicines and they need that. And once,
Right.
now the people are getting import of these medicines, like you mentioned the Ozempic now. The many telephones are coming that we will supply one injection 29,000 to India, which we were having for last nearly more than 10 years in our site, because we are using. But these medicines really help. These medicines really
Yeah.
help. And bariatric surgery also really help patient. But these not only they not only for helping the diabetes reversal program, you can see the remissions, but they also help they also had the reversal of the NAS, non-alcoholic steatohepatitis, or you can say the fatty liver with the inflammation, or you can prevent the cirrhosis. You can
Right.
you can reduce that you can reduce the osteoarthritis, you can reduce the angina, coronary heart disease, many more complications, medical complications can be helped by these medications. And after that the patient go for that lifestyle. So these are combination of the factors are very important. As Dr. Anja said, that you have seen uh, in the India diabetes study, that there is a major difference in the urban rural diet. And the car but main whatever we see, the carbohydrate intake is very high. But once you give these GLP-1 analogs, they not only have the reduction, but the appetite, the behavior is also changed. And after that, they can maintain. And one medicine which is cheap also help for the diabetes remission, the pioglitazone. But rather than weight reduction, it cause the weight gain. But it also help many people go for the metformin and pioglitazone, the cheap medicines. We have seen that these medicines also help for the diabetes remissions. But pioglitazone cause the weight gain, and that is also some side effects in the cardiac patients. But in a thin patient, it can also help for the diabetes remissions, but not all patients.
Yeah. Dr.
So
Anjana?
obesity reduction program ultimately helps for the diabetes reversal program.
Yeah. Dr. Anjana, you would like to add your perspective as well, please?
Sure. So diabetes and weight loss is always a hot topic. Like Professor Singh just said, oldest, best, cheapest metformin, trial tested, helps you to lose around 1 to 2 kg in weight, sometimes produces some bloating, etc., but generally well tolerated. We must be careful in some individuals with kidney issues. We don't start metformin, etc. But otherwise, it's been used for a long time, but the weight loss is rather modest. It's got a very good anti-diabetic effect. A lot of people will be on metformin. Weight loss is modest at best. After that, one of the latest ones are what we call SGLT2 inhibitors. This is very popular these days. It works very well for diabetes. It helps you lose a certain amount of weight, maybe up to 4-5 kilos-ish people lose. It also has now some benefits on the kidney, some benefits on the heart. So used a lot by cardiologists, nephrologists now, other than us also. Does have some, weight loss, but side effects are you can get some genitourinary infections, sometimes needing stoppage of the drug. So this is the second category of drugs that we use. The ones that you referred to, GLP-1, these are good for weight loss, definitely, no doubt. We've had it in various forms, injectable, daily injectables. We had with modest loss on weight, some loss on sugars as well. Worked for some category of people earlier, didn't work for all. Today, we have oral GLP-1, which works in a lot of people. Weight loss can be about 10 to 14 kgs of weight can come down with the drug. It's a kind of graded 3-month thing that we give for the weight loss. And as long as you're on the drug, up to about 14-15 kilos with oral GLP-1, we are able to bring down. Works quite well, for sugars as well. However, these drugs are expensive, quite expensive, and not within reach of a lot of the population. Some GI-related side effects, especially in initial days, are well noted. So people have a lot of nausea, vomiting, don't tolerate the drug. However, once you get past the initial 3 weeks-ish, people it gets adapted. We also give them some gastric protective medicines and things, which helps them get past. Now, the injectable ones, which are causing, all tirzepatide, Mounjaro, Ozempic, Wegovy, none of them are licensed in India at the moment. So are they available? Yes, sir mentioned it. It is, people do source thing. It's not yet licensed though. And while it works, does it bring down weight? Yes, it does. It's expensive, but it brings down weight. It brings down the sugar, etc. Good for weight loss. And, well, you can't call it reversal because you're on the drug, right? For someone to be in remission, you have to be off all drugs. So, but yeah, it does help you lose a lot of weight and thus brings down your glucose level. The main problems with these are that sudden weight loss does put you in some, stone formation. Some people are stone formers, so gallstones and things like that we are seeing. Also, reports from those who have used Ozempic and all that, there's a bit of aging that happens because of fat loss in the face. Because suddenly it's called the Ozempic facies actually. So wherein you start having a little bit of aging issues in the face because of extreme, fat loss. Some people do have that after a period of time, it starts showing on the face and they start looking a bit older. So that is another side effect. By and large, they work well. Best, of course, are the surgical procedures for durable weight loss. Now, all of these, everything that I just said, once you stop the drug, it all comes back on. So it is for the duration of use of the drug. So that's how they work. The surgical procedures, of course, have more durability depending on the surgeon mentioned about the banding, gastric banding balloon. We have various bariatric procedures. Depending on the procedure will be the weight loss. It's the best for large quantities of weight loss. Those are the best. And also they're durable. We now have data for 8, 10, 12 years showing diabetes remission.
Right. So that was that from my side. Thank you so much for joining the conversation, Dr. Anjana and Dr. Singh. Thank you so much.
Thank you so
Thank
much for
you, thank
having
you,
us,
thank you,
and
thank you.
nice to
Rest
meet
of
you.
you. Thank you.